Well, hello, everyone. Thank you for tuning in today. Welcome to It's Time for More Injury Funding, the podcast for all who want to learn about legal funding and its significance in the personal injury, motor vehicle accidents, product liability, medical malpractice, and many other types of law practice domains. I'm your host, Laura, founder and CEO of More Injury Funding, the legal funding counselors with passion for law, medicine, legal funding, and heart for all suffering individuals. More Injury Funding is a sponsor, member, associate, or business partner of this podcast, Academy of Truck Accident Attorneys, Sandy Springs Bar Association, Georgia Association of Paralegals, Atlanta Legal Aid Society, State Bar of Georgia, and Georgia Hispanic Chamber of Commerce. In today's episode, we have a very special guest, Dr. Chakhoyan, Ararat Chakhoyan, and he is an expert witness in TBI, traumatic brain injury neuroimaging. Today, Dr. Ararat will dive deep into exciting topic of traumatic brain injuries and their conventional versus advanced diagnostic techniques and future technology. Dr. Chakhoyan, welcome to It's Time for More Injury Funding podcast.
Hi, Laura. Thank you for having me.
Absolutely. Can you walk us through your educational background and why you chose to take a lifetime path in the study of the brain?
Yes, well, my journey began in 2011 during my undergraduate studies when I spent the entire summer at a local hospital in Normandy, France. During this time, I was shadowing a neuroradiologist in the Department of Radiology, and my goal was to develop different techniques for brain cancer detection using MRI. And subsequently, I was accepted into a master's program in neuroscience and biomedical imaging. It was a 2-year program, and after that, I secured a scholarship to continue my academic journey as a PhD student in a neuroscience laboratory. And there, our research centered on investigating MRI as a diagnostic tool to quantify and understand the impact of oxygen deficiency or hypoxia in brain diseases, including stroke and brain tumors. And in 2016, I successfully completed my PhD degree and joined UCLA's brain tumor research program. And working alongside a team of very talented individuals, I actively contributed to the clinical implementation of a new emerging technique that we will talk for sure later on, which is called pH-weighted MRI. And this new approach allowed us to quantify brain acidity in the brain. And basically, we apply that technique to brain tumors, stroke, and traumatic brain injuries. And following 2 years at UCLA, I received an invitation from USC Zilkha Neurogenetic Institute to join their multidisciplinary team and contribute to Alzheimer's disease research. And since then, I've been at USC, continuously learning and delving into the intricacies of human brain. The human brain.
That's fascinating.
Long
Can you?
story short.
Yes, absolutely. A very interesting story. And you're originally from Armenia, correct?
Armenia, yes, correct.
Okay, that's
Yes.
wonderful. Doctor, can you explain the difference between conventional and advanced diagnostic techniques in the context of traumatic brain injury?
Yes, absolutely. So conventional diagnostic techniques such as computed tomography or CT scans, X-ray imaging, or just basic clinical evaluations are often the first line approaches in the context of TBI, providing very rapid and accessible information for the patient. And in the other hand, advanced diagnostic techniques for TBI are MRI, structural MRI, diffusion tensor imaging, functional MRI or fMRI, more commonly named, susceptibility weighted imaging, positron emission tomography or PET, and SPECT are offering more detailed insight into the structural, functional connectivity changes in the brain. obviously, advanced techniques may require specialized equipment, expertise, and longer processing times. And the choice between these techniques depends on the factors such as the severity of the injury and the urgency of assessment. So,
And what are some examples of conventional diagnostic techniques commonly used at Advanced Imaging Solutions when it comes to you as an expert witness in neuroimaging?
yes, in cases where I serve as an expert witness, the individuals typically sustain injuries approximately 3 to 4 weeks earlier, reaching the chronic stage of traumatic brain injury. And at this junction, MRI stands out as the gold standard for assessing the extent of the lingering brain damage. In that sense, we are heavily using structural MRI as well as diffusion tensor imaging for rule out whether or not what are the consequences of brain injuries.
Okay. And how do conventional diagnostic techniques differ from advanced ones in terms of accuracy and effectiveness?
Yes, I can give you a couple of key distinctions in accuracy and effectiveness of these techniques. First of all, I think sensitivity and specificity are very important. Conventional techniques such as CT scan are very good, to discern whether or not there is bone fracture, hematoma, concussion, and white matter axonal injury at the first shot. But for example, MRI, sometimes in a chronic stage of the TBI, you may have lower sensitivity and specificity to TBI, specifically to TBI, The features that we can see on the images may be from different diseases,
Mm-hmm.
And this is ultimately leading to a higher likelihood of false positive or false negatives. Those are maybe technical terms, but kind of that's the sensitivity and specificity questions. And then there is also image quality. Older methods, older MRI scanners may have limited image quality, and the speed of the exams are much longer for the MRI, old MRIs, while the advanced MRIs are, you can have brain covered within seconds or within minutes,
Mm-hmm.
And one of the main advantage for advanced imaging techniques is that they can provide very quantitative measurements of what you are assessing, while conventional techniques are not as much as quantitative, they are mostly qualitative.
Mm-hmm. And can you provide some examples of advanced diagnostic techniques that have revolutionized the traumatic brain injury neuroimaging?
Yes. First thing that is coming to my mind is definitely diffusion tensor imaging, developed by a French scientist in the early 90s, Denis Lebihan. He's one of the most phenomenal scientists out there. This technique is measuring the diffusion of water molecules in the living human brain, and DTI is providing information about also the integrity of the white matter composition in the brain, offering detailed visualization of, for example, axonal injuries and connectivity disruptions in the brain. Second technique that is very interesting to me is functional MRI or fMRI, that is widely used in the scientific community to study the brain connectivity. What's the impact of such a technique? fMRI enhanced our understanding of the brain changes following TBI. How your brain is getting reorganized after major events such as traumatic brain injury. So we can use fMRI to study cognitive and sensory impairments after TBI. And finally, the last one I want to talk about is called CEST imaging, or chemical exchange saturation transfer. Is very scientific term, but that technique is basically used to quantify cerebral acidosis or the pH imbalance in our brain when we are someone is experiencing traumatic brain injury. We implemented this very new emerging MRI technique at UCLA Ronald Reagan Hospital, specifically to brain tumors, stroke and traumatic brain injury patients. And in that context, in the context of TBI, there is a cascade of biological events occurs following, the injury that can lead to, long-term disability. And one of these patterns is like tissue ischemia from impaired cerebral perfusion, or amino acid excitotoxicity and interstitial acidification. And all this, leads to brain acidity. The brain is becoming very acidic. And so we published that study, that new technique in the Journal of Neuroimaging Clinical, and it suggests the clinical feasibility of and the potential value of pH-weighted MRI as a high-resolution imaging diagnostic tool for identifying most tissues at risk in the brain due to just, cerebral acidosis.
Is there any way to reverse that, to get back to normal? I mean, prior to reverse the brain acidosis in any way?
Well, unfortunately, the microenvironment of the concussion, for example, it's there is no such a drug approved to reverse tissue acidity at this stage. But we first showed that there is it's possible to use MRI as a diagnostic tool, and then there is it must be used in the next steps, to see whether or not there is any drug compounds that could, but at this step, I don't know if there is any compounds that can reverse that phenomena.
Okay, I was just curious. Dr. Chakhoyan, what are the main advantages and limitations of conventional diagnostic techniques compared to advanced ones?
Yes, definitely. Well, today's neuroimaging tools can help in several ways, for conditions requiring, for example, surgical intervention, such as brain hematomas following TBI. Neuroimaging can aid surgeons in precise planning and execution of procedures. Advanced imaging modalities such as diffusion tensor imaging can allow for the more monitoring, or diffusion MRI just simply can help us to monitor the treatment response over time. Mm-hmm. Patients can come back and forth several times, and you can monitor whether or not there is any modifications. And obviously advanced imaging modalities plays a crucial role in clinical trials by assessing the efficacy of new therapies, providing quantitative measures, and definitely very objective endpoints can be established and assessed.
Dr. Chakhoyan, are there any ethical or societal implications associated with the use of advanced diagnostic techniques in your specialty of practice?
Yes, absolutely. Maybe I can separate ethical and societal implications in two settings. For the ethical perspective, new techniques may make it very challenging for patients to fully understand and comprehend the procedures and potential risks. So we need absolutely to inform the patients and having their consent, and socioeconomic factors may also influence the access to advanced imaging, techniques, and potentially exacerbating the pre-existing health inequities, and the collection and analysis of sensitive health information can also raise concerns about patient privacy. For societal implication, we need to implement very robust data security measures to protect patient confidentiality. There's also a real need to protect individuals from discrimination based on health information. And I think to ensure fair access to advanced imaging is kind of very important.
Absolutely. And how do you, as a healthcare professional practitioner, decide when to use conventional diagnostic techniques versus advanced ones?
Yes, ultimately, the decision to use conventional or advanced imaging technologies is a difficult one that requires careful consideration of the specific clinical or research context. In my daily activity as a scientist, I'm mainly using advanced imaging diagnostic tools that align with specific research goals and the nature of the investigation. However, information processing times are very frequently more extended compared to conventional diagnostic techniques. In situations involving TBI, particularly in emergency settings where a swift evaluation is crucial, the initial preference is often for conventional techniques such as CT scans to promptly assess and rule out any acute injuries. So there is that's kind of my answer.
Okay. And what are the current challenges or barriers to implementing advanced diagnostic techniques in neuroimaging world?
Yes, I think the first limitation is related to the cost of these equipments. A brand new state-of-the-art MRI can cost well over $2 million. Then you need to have a well-trained expert to operate and interpret results. And I think from a scientific perspective, the second limitation would be the standardization across different centers. If you are running a multi-center clinical trial in the context of TBI, you must have standardized protocols for image acquisition from one center to another, so the results could be explained and understood, and to reduce variability across centers. So I think that's kind of the second major limitation as of now.
That makes sense. Dr. Chakhoyan, can you discuss any ongoing research or development in the field of advanced diagnostic techniques and their potential impact on neuroimaging after a traumatic brain injury or TBI?
Yes, this is a really interesting question. The search for reliable biomarkers associated with TBI is very broad and it's ongoing, but I think blood-based, CSF and imaging-based biomarkers can provide, if you combine all these, like, blood, CSF and imaging, all together, they can provide very objective measures of the injury severity, prognosis, and treatment response assessment, And artificial intelligence is another growing area that will ultimately enhance the diagnostic accuracy of TBI. If you just give all these metrics that you assess from the patient and you give it to the to an AI, that can most likely in the future be used and enhance the accuracy. And one thing that probably is not yet fully available for clinical use is PET imaging, new specific PET imaging tracers that are targeting brain inflammation. And basically, TBI is going to trigger a lot of events in the brain. And there are some cell types in the brain called astrocytes. They're going to be activated, these astrocytes, after a TBI, and they're going to release pro-inflammatory cytokines and chemokines. So basically, with PET imaging, we can also, in the future, see brain inflammation following TBI. So the potential of these ongoing research efforts is broad. All things considered, I believe that we can now achieve a better understanding of long-term consequences of TBI.
Very interesting. And what is one or two most common tests that you perform on your patients after car accidents or trucking accidents?
Yes. As of now, the primary test I'm doing is 3T MRI, 3 Tesla MRI, which is one of the gold standards as of now. And all our patients they are referred even for screening purposes to a 3 Tesla MRI, including like structural MRI and diffusion tensor MRI. That's pretty much what my firm is doing. Yes.
That's fascinating, and that was super interesting the conversation. I wish we had more time today. Unfortunately, our episode is coming to the end. I hope, my dear listeners and viewers, today you've learned as much as I did about TBI, conventional and advanced diagnostic techniques, and future technology. But before I go, Dr. Ararat, I have an extra question, fun pop-up question. You ready for that?
Yes.
Okay. How would your parents describe what you do for work?
Wow, well, coming from a family with medical background, significantly easy is my journey, to be honest. My father established himself as a forensic doctor expert witness. My twin brother is also a medical surgeon, so it makes my life very easy to explain what I really enjoy doing as a scientist and expert witness.
That's just amazing. Again, that was Dr. Ararat Chakhoyan, ladies and gentlemen, with Advanced Imaging Solutions in California. And if somebody needs to find you, how can they find you, doctor? Do you have a website, social media platforms?
Yes, I think I'm very active on Instagram. I think the easiest way is to follow us on Instagram by searching Advanced Imaging Solutions. You will find all the details. If you have any questions, feel free to reach out to me, and I will be glad to help with your inquiries.
That's wonderful. Again, I want to thank to all of you for listening and watching our story today. For more tips and tricks on legal funding and personal injury law related topics, follow me, download, like, and subscribe. For it's time for a more injury funding podcast on several podcast platforms, including but not limited to Spotify, Amazon Music, Apple Podcasts, iHeart, Google Podcasts, and others. And follow me at More Injury Funding on LinkedIn, Instagram, Facebook, Twitter, TikTok, Pinterest, YouTube, Yelp, Google Business Profile, and of course, my website at moreinjuryfunding.com. I can't wait to see you, my dear listeners and viewers, at my next coming episode. Tune in soon for our next guest. Until then, be well. Thank you so much.
Thank you.